numbers, and they're all locally acquired with 0 cases through hotel quarantine. That brings us to 159 cases over the 12-day period of this outbreak to date, all Delta and all linked to the New South Wales incursion. We have 10 cases in hospital, 3 in ICU, with 1 on ventilation, and I'm sure we all send our best wishes to those people and their families and carers and supporters, and thank our hard-working hospital frontline workers for the care they provide. There were 19,281 vaccination doses administered through our state-run clinics yesterday, and that was accompanied by some 39,846 COVID tests that were also done yesterday. Overall, we're pleased to see an encouraging trend down in case numbers, and certainly not an increase. Not a huge trend down, but in terms of the direction and particularly the issues that the Chief Health Officer will go into, a reassuring trend towards the cases overwhelmingly being in quarantine, being in home isolation for the entirety of their infectious period. The number of people moving about in the community when infectious, as I say, is trending down, which is a good thing. That's a critical part of stopping the virus spreading in our community, and when attended to, the wider restrictions that are in place gives our public health team the confidence that they can look to. Too early to call yet as to what might be the position come Tuesday night. As I indicated, 10 of the 12 community cases were in isolation during their entire infectious period. The 2 cases who were out in the community were only active in the community for less than a day, with only a small number of retail sites variously in Camberwell, Hawthorn and Newport being listed as a result. And I want to thank those people for, as soon as they were advised of their primary close contact and their positive status, isolating straight away. These are the encouraging, positive parts of where we're at, but we know that this virus is still active in our community. We still know that there are chains of transmission in our community. Yes, they're all linked, that's positive, but they're still there, and that's a risk. Of today's 12 new community cases, 5 cases are linked to the Amy Park outbreak. 1 is a social contact of a previously identified case that attended the game, and 4 household contacts of a previously announced case. So that's 5. A further 3 are linked to Miss Frankie's in Cremone. 1 is a patron who visited the venue on July 15th, and 2 are household contacts of a staff member. That's 8. There's a further 2 linked to the Burnley apartment complex, where a positive case who was there but had moved into hotel quarantine some time ago. We've seen 2 fellow residents who live on the same floor as that person who had previously been announced turned positive as a result of their most recent tests. So that brings us to 10. 1 is linked to Bacchus Marsh Grammar, a student. That's 11. And 1 is a household contact related to one of the generations attached to the Young and Jackson's case. So that brings us to the total of 12. Today we also have some now 22,718 primary close contacts associated with these 159 cases, and now we have passed more than 400 exposure sites. So just pause on that. 22,718 Victorians are doing the hard yards on behalf of us all to make sure that we isolate these chains of transmission as quickly as we possibly can. And can I thank all of those people? It's an extraordinary number. It's the highest number that we've had during the course of the pandemic. And those people, the support that community is bringing them, that health services are bringing them, that families and others are bringing them is critical. And I want to thank every single Victorian, both those 22,700 and others who are part of the frame of making sure we get those people through their isolation period, because that is just so important. More than 20,000 Victorians isolating in the home is not easy, and of those, 2,500 are from the MCG alone, and they are now hitting their day 14 test mark. We have cleared almost 2,000 of the personal close contacts from the outbreak so far, and we will see around another 4,000 day 13 tests over the course of this weekend, with a further 8,000 due in the coming week. So that's an extraordinary number of people who will start to be cleared through this process. And I want to thank the huge cooperation that they've lent, but equally, just ask them for just one big last effort in getting us through those 14 days. If you are a primary close contact of a person with COVID-19, or you're at a Tier 1 exposure site, in order to end your isolation at the end of your day 14 of isolation, you need to get a day 13 test, and for that to be negative. At some time before your day 13 test, you will receive a message reminding you of that day 13 test requirement. You should and you must get that test. If you don't get tested on day 13, you must in fact stay in isolation for a further 14 days to bring your total to 28 days, or until you get that negative test. So please, if you're in that category, stay alert to the phone calls and engagement that you will get from local public health units and the Department of Health. Please also do not take public transport or a taxi or an Uber for that day 13 test. If you test negative, you will be contacted on day 14 by phone for a short public health assessment just to clear you.